Hey, this is Dr. Goodman. This is Doc Talk Live, and I'm with Ashley Weiss. Ashley is social distancing herself in New Orleans at Tulane. She's a psychiatrist at Tulane University. Is that correct?
Yes. There's a
And
delay.
and we have a bit of a delay even in our communication, so I will try to talk slowly. But tell us a little bit about the coronavirus or COVID-19 and where you're at Tulane to start with.
Um, in terms of the virus and the COVID-19 from the psychiatric standpoint, we are all providing a lot of telepsych services for our patients, doing therapy via telehealth. Some of us are still seeing people in person. For instance, I work in at the jail, the local jail, a couple days a week, so we're still seeing patients there with a lot of precautions, and just trying to be really flexible with how we're providing patient care.
Um, we get a lot of updates about how many patients have the active virus, how many people are being tested, and precautions and social distancing. So a lot of that information is available. But as a psychiatrist and also somebody who is involved in public health, you may have a unique perspective on the psychological impacts that really have not been talked about or shared with in mainstream media. Could you comment on
Yeah, I mean, the first thing that I think about is that, in particularly in my area of work, taking care of young people with psychotic disorders, there's a lot of isolation that comes from having those types of psychiatric symptoms and experiences. So, for those that I work with, I worry about this being almost an exponential experience of isolation, given that they're starting out from a place of not feeling very supported by a community and not feeling very supported by society in general. And so we've been making extra efforts to increase their connectedness with us, because we were, the team that I work with, we were a part of their community. And so now and we might have been the only part of their community for some time. And so now kind of losing the interface with us, we're concerned about how that's going to impact an already sort of marginalized and isolated community.
um, that's interesting because these are people that need community or don't have enough, and now we're
Mm-hmm.
isolating them
Mm-hmm.
further. Um, and I guess the problem I see is how at risk is this particular population at being exposed to the virus itself? Isn't the lack of community potentially more harmful to them than the risk of viral
I
exposure?
think it would depend on where they're going and whom they're interfacing with. Um, if it's depending on the ages of their family, depending on their children or where they work. That's really, we do take care of some people that live in community settings, live in kind of a group home type of scenario where they're actually probably at more risk of having a cluster of exposures. But, you know, staying, if your behavior on a day to day is typically staying in home or staying in your own small knit neighborhood, then it would be potentially less community exposure. But nonetheless, you're never, you're not, you don't know the exposures of those that are around you. And I think that that's a little bit of the frightening part of all of this is, the people that you were around and not knowing where they have been.
What about in our regular communities where people don't necessarily have treatable mental illness or not being treated for mental illness, but are just sort of the everyday community? How does this affect quote unquote just regular old working folk?
I lost the last thing that you said.
How does this affect just regular old working folk?
I think it depends on your lifestyle. I mean, for my extroverted friends, this is a very trying time because their regular routine has been disrupted. I had one friend text me and she said, I realized that my lifestyle in general is like I'm quarantined because her day to day has not actually changed that much. And so that variability between people, I think, is maybe more pronounced than one might assume. But also just, change is a bit uncomfortable for all of us, mental illness or no mental illness, and having the unpredictability with this change, which can breed a lot of anxiety and discomfort. So not only are we having to change our lifestyle, but we also are not able to predict what's going to happen as well. So it's a little bit of an open-ended question right now.
So what would you tell these people on how to deal with the anxiety of if they're extroverted, the isolation, if they don't like change, or they like predictability and things change from moment to moment? What would you tell these people on how to deal with the situation? What would be your psychiatric advice?
My psychiatric advice. I think the biggest potential risk, I think acknowledging feeling states is really important and not necessarily attaching some sort of meaning to it. If we're feeling anxious, we're feeling anxious. People have a tendency to sort of starting to get into this thought process where they're thinking about, okay, well, what if tomorrow is like this? And then if tomorrow we run out of food, then what are we going to do the next day? And then the next day, and kind of it becomes a snowball effect, which in turn increases your anxiety. So, being aware of when that starts happening in your own mind as a way to sort of check in with yourself. It's not all of the time that we're walking around thinking about thinking. And this is actually a good time to begin to notice actually what's going on in our mind, especially when we're having some kind of anxious feelings or panicky feelings, and actually to be a little bit reflective in that moment to hopefully identify what is it that's making me feel this way. Is it because I just automatically assumed that I'm going to be quarantined for 6 months? I don't really know that. And, then you're reassuring yourself of that's the future I have right now, and trying to be more present in the moment.
So my personal issue would be not the problem wouldn't be recognizing the feelings. It would be having the feelings, but then reacting to them, and reacting in such a way that would lead to a poor choice. And so, yeah, recognizing that you're anxious is important, but even if you recognize it, how do you then take the next step and not react to
Well, I
it?
think it would depend on what the reaction is. You know, is the reaction to be intentional about doing something that's healthy for you, you know, before it's a, you know, if you're typically, if your reaction is typically to lash out at someone else, making a conscious choice in the moment to maybe do something caring for yourself as the reaction. How can the reaction kind of help me get through this moment? Do I take a walk? Do I, you know, different things work for different people. Do I need to be alone for a minute? Do I need to take some deep breaths? Do I need to, you know, listen to music, whatever it is that kind of can distract for a moment? Because even the distraction will alleviate anxiety just as much as the activity or the reaction itself. You know, if your go-to is to kind of take some time alone and do some deep breathing, you know, being conscious that I'm actually going to do this in order to help myself feel better, anxiety typically will come down more. The awareness will help the anxiety.
Okay, you mentioned you mentioned certain populations that are marginalized, like I guess schizophrenia, because of their disease. How would this affect people with, let's say, attention deficit disorder, or depression, or other sort of common mental illnesses,
Um,
or I shouldn't even say mental illnesses, common personalities,
I mean,
even.
you mentioned people, ADHD. I mean, ADHD is not the easiest thing to function with, and the way to help people from a behavioral standpoint is structure and predictability. So we're kind of getting rid of maybe the routine that they had in the past and having to recreate a routine given the environment that you now have, whether it's in your home or your family's home, one room of your home. You know, how can you recreate that structure in a new setting? And having to be creative about it, which can be challenging sometimes, you know, trying something new. But with, you know, with people with depression that tend to be more isolative, this can definitely be a risk of exacerbating their sense of isolation. And so, you know, one of the things that we'll often recommend with depression is behavioral activation, and that can be that is when you sort of prescribe a certain activity at least once a day in order to get your brain working in a way that is having to accomplish tasks, which then sends a positive reinforcement signal, and it actually helps people get well. So having to adapt those types of treatment plans in settings that are going to be a little bit more limited, as opposed to what we're used to. But really, all you know, most of our behavioral types of interventions can be adapted to different settings. When we do this all of the time, because most of my colleagues, we work in different settings. So we might have a similar, you know, the same idea of a treatment plan for someone in a hospital that might be just going home. And so I think not to forget that you can't be creative in adapting to your environment, adapting your treatment plan to your environment.
So somebody has typed in, good question, doc. My anxiety is off the chain. And I do know who's typing that in, and this person is constantly on the go, and in many ways is a lot like me. And so far, this um, this social isolation, in a way, has been a welcome respite for me. But I can imagine that after a few more days of this vacation, if you will, from my incredibly hectic and busy life, is going to get to be actually challenging and make me a bit stir crazy.
Yeah, for sure.
So
I have the same. I mean, we all have the same types of experiences. I remember thinking a couple ago, I'm never in my house. Rarely am I ever in my house, and instead of I've been having to remind myself that instead of seeing that as a problem that I'm in my house a lot, now I'm kind of starting to actually notice things about my house that I like and enjoy them. And I've been busier though lately. Actually, I've never spent this much time on Zoom conferences, but it's been all day long. It's a new type of busy. Even though my physical body hasn't moved out of my house, I'm still really busy. So I've been having to think about new ways to deal with the new stress of kind of feeling stir crazy in this room.
right, or trying to find new ways to feel stressed.
Right. My treatment team and I've been almost getting a little bit excited about this because we've wanted to try to meet the needs of people, young adults, late adolescents, and they're all about computers and technology and being more creative. And so figuring out how we can do more Zoom conferencing with them. It doesn't have to be a formal meeting at the clinic, but just having the connection. We've actually felt more connected in some ways than we've had in the clinic. And
Right.
finding more
I wish I had the technology to bring more people into this Facebook Live stream, where other people could share their experiences and we could all talk. But I guess we're not there yet. But hopefully, I'm so technically challenged. That's part of the problem.
We've had
But
this. The Zoom conferencing is amazing. I just got off a 50-person faculty meeting. I could just see them all lined up. It was kind of the coolest meeting that we've had in a while. So we all are looking at each other.
That's amazing.
Not trying to downplay the fact that yes, this is anxiety provoking because your lifestyle changes, and also we're hearing from those in charge, and we're getting this messaging from around us that then it's like multiple layers of anxiety, which is why.
So just tell us a little bit about, before we get off, where you're at Tulane and how people, may or may not interface with you, your department. That would be great.
Yeah, so within the Department of Psychiatry, there's several different sections. There's child psychiatry section, the forensic section, the addiction section. I'm faculty within the child psychiatry department. I'm a child adolescent psychiatrist by training. Most of us don't work in one clinic. We're spread around all of New Orleans. Some of us are at University Medical Center doing inpatient work. Some are doing outpatient work in various capacities. We have a behavioral health clinic in Metairie that does more general outpatient mental health. They're available even right now to start seeing people via telehealth. And that's not a problem with insurances right now. A lot of the insurances have become more flexible now with allowing telepsych. So you can see somebody if you need to see someone. You can have therapy if you need to see someone, and your insurance is going to pay for it. That's Medicaid, Medicare, commercial across the board. And yeah, we still do some special.
If this if this Doc Talk Live reaches people in New Orleans, what is a phone number or a website they should go to?
They should go to Tulane Department of Psychiatry and the Metairie-based mental health clinic is where they should call for more general psychiatric needs. So depression, anxiety, and those types of issues. If it's more on the severe mental illness range, then they should look for my clinic online.
Okay. Ashley, thank you so much for taking the
You're
time
welcome. Thank you for having
to be with us.
I wish everybody luck.
Yeah, thank you.
Bye-bye.
Bye. Thank you.
Bye-bye.
Bye.